education activities and programs. In the past year, she was diagnosed with celiac disease herself, which has fueled her passion to find high-quality gluten-free foods and develop her own recipes. And her presentation today is called "When the Gluten-Free Diet Isn't Enough, the Benefits and Risks of Common Diets in Celiac Disease." So my distinct pleasure to hand over now to Jedid-Jah Blom.
Hello, everyone. Thank you very much for joining today. I'm very delighted to talk about different diets in the management of celiac disease. Are you able to see my screen?
Yes, looks good.
Absolutely.
Great. So first, a little bit of background. As we heard before, malnutrition, including vitamin and mineral deficiencies, are very common in the celiac population. Most common nutrient deficiencies are zinc, iron, and vitamin D. And several popular diets have been adopted by people with celiac disease to help meet nutritional needs. In this presentation, I'll show you more about the composition, the benefits and challenges or risks of 4 popular diets. And these are the plant-based diet, Mediterranean diet, the ketogenic diet, and the low FODMAP diet in adults with celiac disease. So first of all, the plant-based diet. This is a range of different dietary patterns that exclude animal-derived foods to varying degrees. So typically, a plant-based diet contains about 85 to 90% of calories that come from plant foods. So if you have a calorie intake of 2,000 calories, about 300 calories can come from either dairy or another meat, chicken, or fish source, and that would still be a plant-based diet. Technically, also ultra-processed foods are mainly plant-derived, so they would meet criteria to be included in this diet. However, in this presentation, I'll only refer to a plant-based diet that consists of minimally processed foods, and you'll see soon why this is. Then there are different reasons for adopting a plant-based diet. So it can be for health benefits, for animal welfare, cultural or religious beliefs, and environmental concerns. There's also guidelines developed for health professionals to help effective use of plant-based diets for patients. What are the benefits? So the plant-based diet is a more sustainable diet than diets that are based on animal products. There are no published studies of the effects of a plant-based diet in the celiac population per se. What researchers have developed, though, is a plant-based diet index, which you can see the table on the right side. It shows you healthy plant foods. So those are supposed to be incorporated more often. And then you're supposed to limit the intake of unhealthy plant foods as well as animal foods to follow a plant-based diet properly and to have a high-quality diet. Now, in the general population, there have been several studies investigating a high-quality plant-based diet, finding that it reduces the risks of chronic diseases, for example, cardiovascular disease, type 2 diabetes, certain types of cancer, as well as kidney failure, and also leads to decreased waist circumference. What I have to mention is that a diet that has a high intake of unhealthy plant foods is associated with an increased risk of these chronic diseases, even if you were to limit your intake of animal foods. So very important that you have a look at that middle column. And it's not only about what you do eat, but also what you don't eat. There was a study done in 2017 in people with diabetes, and they found that if they follow a plant-based diet, they had significant improvement in blood sugar levels, in their heart disease risk, gut bacteria, and in inflammatory markers. Now, can you meet your daily nutrient requirements following this plant-based diet? Of concern are omega-3 fats. Those are essential fats. They have to be consumed through food. And there are different types, ALA and DHA and EPA. So you can either incorporate chia seeds, flax seeds, hemp seeds, walnuts, or canola oil to get your ALA needs met. And for DHA and EPA, you can eat more fish, you can take a supplement, algal oil, spirulina, or chlorella, or even seaweed. Vitamin B12 is produced by bacteria in the gut, but not in sufficient amounts. We have to get some from food as well. Nutritional yeast is an option, fortified foods, mushrooms, and some algae products. Now, since B12 absorption declines with age, over the age of 50, you will have to take a supplement, regardless of what types of food you eat. Calcium is also of importance, and we know that absorption of calcium-rich plant foods is reduced because of the oxalate content. If you cook or soak your food, that will help with absorption, and you can also choose lower oxalate calcium-rich foods like broccoli, kale, arugula, and so on. You do need vitamin D to help absorb calcium to make bone tissue. And so if you're not getting enough vitamin D from food alone, you will have to take a supplement. You can also ask for getting lab values tested to make sure where your vitamin D levels are. Then iron. So animal foods contain iron in heme form, which is better absorbed than the non-heme iron that's found in plant foods. And we know that generally people who eat a plant-based diet consume as much iron as the omnivores, but they tend to have lower iron stores and a higher risk of anemia. So this is because iron absorption is inhibited by oxalate, phytate, and polyphenols in plant foods. So you can choose foods that are lower in these compounds like kale, collards, bok choy, or broccoli. Also to enhance absorption, you can add vitamin C or acidic foods, such as citrus, tomato, vinegar, apple, or grapes. Another option is to cook with cast iron cooking pan or adding or using fluid from cast iron fish, cook with cast iron fish. Then zinc is also decreased by phytates in plant foods. So you can soak, sprout, or ferment foods to increase their absorption of zinc. But a well-balanced plant-based diet can meet zinc requirements, and you can find zinc in nuts, seeds, legumes, and in whole grains. What we can conclude is the pros of the plant-based diet is that it can be adapted to be gluten-free. And if it is well-balanced, it can meet all nutrient requirements. A well-balanced plant-based diet also helps to reduce the risk of multiple chronic diseases. And if it's planned well, then it can contain adequate nutrients to help prevent osteoporosis and iron deficiency. The cons are that the research investigating adherence to a plant-based diet long-term and the effect of a gluten-free plant-based diet on the health of people with celiac disease is needed. Following a restricted food intake, like a plant-based diet, may also mask an eating disorder, so it's important to screen for this, as we don't want your food intake to become too restricted. And the Mediterranean diet, this is a diet that was first recognized by Ansel Keys when he went to visit Greece. He saw that in the Mediterranean region in the 1960s, people had lower rates of chronic disease and they had a higher adult life expectancy. When he looked at their diet, he saw that it was high in whole grains, in vegetables, fruits, nuts, fish, and olive oil, as you can see the base of the pyramid. And then it had moderate amounts of milk products, of fish, poultry, eggs, sweets, and meat. And it also contained moderate amounts of wine. The Mediterranean diet is not only about what food you eat, but is also a lifestyle. So it includes doing daily physical activity. We recommend about 150 minutes per week, and you can do this in bouts of 10 minutes at a time. Also, getting enough sleep, enough rest is important. Planning time to prepare and cook your meals, and eating family meals. This is a questionnaire that researchers have used to measure adherence to a Mediterranean diet. You can fill this out. You can find it on Google, and then you can fill it out for yourself to see how well you are following a Mediterranean diet. So there's 14 questions. And if you answer yes to all of these questions, then you have a high adherence to the Mediterranean diet. Now, there's a group of researchers, Messias, who looked at what exactly is the nutrient intake of people who are following a Mediterranean diet. So we found that these people, if they eat about 2,000 calorie Mediterranean diet food intake, then their intake of fat is quite high compared to what Health Canada would, for example, recommend. And that's due to the amount of olive oil, the amount of nuts, and fish. That is a very important part of the diet. You are able to meet your nutrient intakes in terms of fiber, iron, calcium, and zinc if you pay more attention to where you're getting your food from. The benefits are that it is a palatable diet. It focuses on whole food intake, plant-based protein sources, and a high amount of unsaturated fats. And it may be better sustained than other diets. More research, however, is needed to see if this type of diet can be adopted long-term by North Americans, because we have a high intake of processed foods, which is not part of the diet. A very important study that was done looking into the benefits of the Mediterranean diet is a Predimed study. And that study found that there are multiple health benefits in the general population. It helped to prevent heart disease. It decreases the risk of type 2 diabetes, decreases the risk of metabolic related conditions. It helps prevent certain cancers, and it lowers the risk and delays onset of certain mental health conditions. I could only find 2 studies that looked at the Mediterranean diet in celiac adults. One is a cross-sectional study. It looked at how well are Italian adults with celiac disease adhering to a Mediterranean diet, and then comparing that with a control group. They found that the celiac group had a higher intake of potatoes, they ate more red processed meat, and had a lower intake of fruit compared to the healthy participants. Then the other study investigated the relationship between adhering to a Mediterranean diet and psychological symptoms. And they found that a higher diet adherence was associated with a decreased intensity of several psychological symptoms in the female group, which was the largest part of the population that participated. So we basically can conclude that it's important to encourage celiac clients to adapt to a Mediterranean-style gluten-free diet to help manage psychological symptoms, but it's only based on this one study. Challenges of following a Mediterranean diet is that there is a common concern that a diet that's high in fat may lead to weight gain. However, the diet is really focusing on whole foods and plant protein sources. So research actually shows that the Mediterranean diet is associated with weight loss. This is a cultural diet in the Mediterranean region, so you may not be as familiar with the foods. Some of the foods may not be widely available or more costly when you're purchasing them in Canada. For example, fish and seafood, olive oil, gluten-free whole grain foods, gluten-free nuts and seeds, gluten-free legumes. You can conclude that the pros are the diet can be adapted to be gluten-free, and it can meet all nutrient requirements. The gluten-free diet can actually be improved if you are substituting ultra-processed foods with gluten-free whole grains and nuts, legumes, and olive oil as recommended by this diet. And it can actually make the diet more affordable. The Mediterranean diet also reduces the risk of chronic diseases, including metabolic disease, which has become more prevalent in the celiac population. And then the cons is that research suggests that people with a gluten-free diet have poor adherence to a Mediterranean diet. And we'll talk about the ketogenic diet. So the ketogenic diet is a low-carb diet. Typically, it's recommended to eat less than 50 grams of carbohydrates per day, and those are net carbohydrates. So if you're taking the total amount of carbohydrates in the food, you have to deduct the amount of fiber, which is not absorbed, and then you get net carbohydrates. A consumption of less than 30 grams of net carbohydrates in a day will move the body into ketosis. That's the goal of the diet. So then you'll start fat burning. Your body will substitute using glucose for energy for using fat stores. It will take about 3 to 5 days with this restricted carb intake to deplete glycogen stores in the liver and the muscles, and then your body will shift to a new energy source, which is ketones. A moderate amount of protein has been used in studies without any negative effect. If you exercise frequently, then you may want to increase your protein intake to make sure that you're still building muscle. So you can eat 2 grams of protein per kilogram body weight per day. It's very important that a very low carbohydrate intake is maintained to maintain the state of ketosis, so not more than 50 grams of these net carbs per day. What does the diet look like? So you can see the foods that are allowed and then the foods that are not allowed. There's not really room for any grain products. Your intake of fruit is limited to certain berries, and only non-starchy vegetables can be incorporated. There is a large variety of protein-rich foods that can be part of the diet. For milk products, it focuses on higher fat, higher protein milk products that have a low lactose content. For fats, you could choose different vegetable oils, and also sweeteners could be incorporated if they're non-caloric. So it's important to read food labels and to count the amount of net carbohydrates that you're consuming, because you cannot eat more than 10% of calories from carbohydrates. Benefits of this diet: it leads to rapid initial weight loss related to these glycogen stores being depleted and also causing water loss. It also decreases hunger, it reduces sugar cravings, it improves your blood sugar levels, improves blood pressure, and improves triglyceride levels. However, the challenges are that it is difficult to maintain this ketogenic diet. It's very restrictive, and so research shows that in the long term, this diet actually leads to weight gain. When you're starting the diet during the ketosis phase, your body will excrete extra water and salt. So you may get symptoms of headache, fatigue, nausea, dizziness, which is called the keto flu. In that case, you'll have to drink more water and also add extra salt to your food intake. To prevent nutrient deficiencies like potassium and magnesium, it's recommended to take a multivitamin. And since this diet is low in plant foods, it's low in fiber and may cause constipation. So it's recommended to take a fiber supplement and to drink more water. Very important to know that the ketogenic is not safe for individuals who have diabetes and are taking insulin or GLP-1 inhibitors, or for people who have disordered eating behavior. Also, if you are on blood pressure medications, these will have to be adjusted by your doctor. So always see your doctor first before you're starting a very restricted diet like this one. The pros of this diet is that a healthy ketogenic diet will lead to multiple rapid health benefits in the general population. The cons are that it is a very restrictive diet, it is difficult to adhere to, and definitely recommended to be guided by a dietitian. There's also a website with some useful resources. The ketogenic diet has multiple risks, so it's not recommended for everyone. Discuss with your doctor before you start the diet. Research is emerging that the diet may not be effective long-term, and there is no research conducted in the celiac population. Last diet, so the low FODMAP diet is a diet that was first developed by researchers at Monash University to help manage symptoms of irritable bowel syndrome. This is a functional bowel disorder. It affects 1 in 7 adults. It's characterized by digestive symptoms that are not explained by other disorders. So you'll have low abdominal pain, bloating, excessive gas, distension, and also altered bowel movements. So it could be diarrhea, constipation, or both. IBS symptoms are common in people with celiac disease, and they should be discussed with your doctor before you're making dietary changes. Often it's recommended to make lifestyle changes, like increasing exercise, improving sleep, better diet, and stress management. There's a traditional IBS diet that was described by the British Dietetic Association and the NICE guidelines, which you can see in the graph on the right side. So it recommends to eat 3 meals and 3 snacks per day, increasing fiber intake, making sure you're chewing your food well, other mindful eating practices. And then it recommends to limit or reduce your intake of alcohol, coffee, soda, sweeteners, onion, beans, and cabbage, chewing gum, and fatty and spicy food. There's a large body of research that shows that certain dietary sugars that are called FODMAPs trigger these symptoms. And so following a low FODMAP diet decreases symptoms in 50 to 75% of adults with IBS. So what is this diet? To understand it better, we will look first at digestion and absorption of nutrients. So in the small intestine, food is broken down by enzymes and digestive juices into nutrients, and those can be absorbed. Then in the large intestine, water is absorbed and the stool is formed. Now, if you have a look at these FODMAPs, those are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They're very small sugars, and they're naturally present in multiple foods, vegetables, fruits, grains, dairy, and legumes to varying degrees. Now, in people with IBS, these small sugars are very poorly absorbed in the small intestine. If you look at the graph, you can see these black little sugars. So when they get into the small intestine, they attract water. So more water will get into the small intestine. It can cause diarrhea. But what will happen is it will flush into the large bowel. And then you can see these little gray molecules. Those are the organisms. Those are bacteria, and they love eating these small particles. They ferment them, and then that produces gas. That will lead to symptoms like bloating, distension, flatulence, abdominal pain, or it could also cause bowel urgency, and in other people it causes constipation. So how can we prevent this? By reducing the amount of FODMAPs that can help prevent and reduce symptoms of IBS. This diet exists of 3 phases. Phase 1 will be to eliminate all of these high FODMAP foods in the diet for 4 to 8 weeks until symptoms significantly decrease. And in phase 2, these FODMAPs will be reintroduced. They will be added back one group at a time to see what foods cause symptoms and in what quantity. That will take another 5 weeks. Then in phase 3, you will follow a personalized low FODMAP diet. So the person reduces the amount of FODMAP foods that they are personally sensitive to. So that varies per person. In this table, you can see different groups of FODMAPs and some examples of foods. There's many more foods that are high FODMAP. The benefits are that there's 2 studies I'd like to mention. A study in 21 celiac patients following a low FODMAP diet. They had a reduction in abdominal pain, improved stool consistency, and general well-being after following 3 weeks of a low FODMAP diet. And another randomized double-blind intervention study of 46 celiac patients on a gluten-free diet for more than a year. They had normalized celiac blood markers and still had digestive symptoms. So when they followed a low FODMAP gluten-free diet, they found that they had a higher intake of fruit and a lower intake of legumes and grains compared to people on a regular gluten-free diet. But the overall nutritional quality of the diet was not different between the groups.
Jedid, would you be able to just summarize the low FODMAP diet so that we can leave some time for discussion? I'm sorry to butt in.
Yes, so we can go to the conclusion. I'm not able to move my slides.
Just click on the screen and you should be able to advance your slides.
No, I'm not able to. Okay, there we go. Oops. So basically for the low FODMAP diet, it's a very restrictive diet, has to be followed under guidance of a dietitian. And in the end, you will follow a personalized diet that's less restrictive, but symptoms may flare up. And then overall, what we can conclude after talking about all of these diets is that research shows that eating less processed food increases the quality of a gluten-free diet and helps prevent the risk of chronic diseases. Also, a lower intake of saturated fat and more unsaturated fat helps support cardiometabolic health. The low FODMAP diet is this restrictive diet that's only for digestive symptoms in people with IBS. And more research is needed to investigate the effect of the diets in the celiac population. Now, to increase adherence to a whole food gluten-free diet, it is, I think, very important that we find better access to a variety of gluten-free whole grains, legumes, and nuts to be able to adhere well to any of these plant-based diets. Thank you very much.